Hi, my name is Diana. I'm an RN to BSN student at Nevada State College, and I would like to have your permission to do a videotape for my professor of a head-to-toe assessment. Is that all right?
Mm-hmm.
Okay, could I have your first name?
Darian.
And what is your birth date?
September 21st, 1995.
And how old are you, Darian?
18.
Okay, very good. Darian, do you have a history of any surgeries?
No.
Any diseases?
No.
Do you have currently take any medications?
No.
Okay, do you have any allergies?
No.
Okay. Do you smoke?
No.
Do you drink alcohol?
No.
Do you take recreational drugs?
No.
Okay. What is today's date?
December 2nd, 2013.
Okay. And who's the president?
Obama.
Okay. And what city are we in?
Las Vegas.
Okay. Darian is alert and oriented to person, place, and time. His facial features are symmetrical. There's no lesions. He appears well nourished. His speech is clear and understandable. Okay, Darian, for this head-to-toe assessment, I'm going to need to do some touching and listening and palpating. Are you all right with that?
Yes.
Okay. All right, I'm going to touch your skull. Skull is round. No lesions or masses felt. Hair is well distributed. Okay. Any pain on palpation of the sinuses?
No.
Sinuses are clear. Can you open your mouth and close it? Any pain with opening that?
No.
Okay, temporomandibular joint functions smoothly. Okay, Darian, notice the skin tone on your ears. Everything looks symmetrical and even, facial features. Okay, your eyebrows, no scaling. They are symmetrical. Your eyes, sclera is clear and white. Let me pull down on your eyes. The lining is conjunctive lining is pink at the lower lid. Okay. Lacrimal glands are clear, no redness, no edema. Let me look at your corneas. And irises are round and color is even. Corneas are flat. Pupils react to light. Darian, I'm going to check your accommodation. Can you look over at that flower over there? Okay, now look at my finger. Okay, Perla. Pupils are round, reactive to light and accommodation, and are reactive. Okay, there. I need to look at your ears. The ears are well aligned. No lesions, redness, no foreign bodies are seen in this ear. No exudate. And the same for this ear. Okay, let me look at your nose. Nose is symmetrical. Okay, I'm going to check for patency of your nose. Okay, take a deep breath in. Okay, and take another deep breath in. Nares are patent. I'm going to test olfactory cranial nerve number 1. Could you tell me what you smell here with your left nary?
Vanilla.
Good. And with your right nary?
Mint.
Very good. Cranial nerve number 1, olfactory nerve, is intact. All right, Darian, I'm going to need to look at your mouth. Flashlight again. All right, open up your mouth. Okay, lips are moist and non-cracking. Buccal mucosa is pink and moist. Can you stick out your tongue for me? Let me move it to the side. Tongue is moist. No lesions, no redness. Okay, let me look at your teeth. Teeth margins are tight. Okay, open your mouth again. Okay, and stick your tongue out all the way. Hypoglossal glossal nerve, number 12, is intact. Tongue is in midline. Okay, Darian, can you say ah? Okay. The uvula is midline and elevates. So, cranial nerve number 9, the glossal pharyngeal nerve is intact. Your tonsils, you can barely see them, so they are +1 bilaterally. Your soft palate is palpable, moves, and is pink and moist. And the hard palate is white with a few transverse rugae and no lesions or redness seen. Okay, Darian, I'm going to stick this in your throat. Okay, gag reflex is intact. That's the biggest nerve, cranial nerve number 10. Thank you. Okay, Darian. I'm going to check your neck now for movement, range of motion. Can you move your head side, put your ear to your shoulder without moving your shoulders up? And other side, and forward, and backward. Good. Okay. Can you push against my hand? Okay, push against my hand. Cranial nerve 11, spinal motor nerve is intact. Now I'm going to check your facial nerve. Can you smile? Can you clap your teeth in? Okay. Squeeze your eyes. Can't open them. Good. Can you crease your forehead? Okay, very good. Now puff out your cheeks. Facial nerve, cranial nerve number 7 is intact. All right, Darian, I need to check your lymph nodes in your neck. Okay, preocular lymph nodes. Let me know if any of them are tender, if they hurt. Okay, postocular, auricular nodes, jugulogastric, submandibular, submental. Okay, now I'm going to fill your superficial, posterior deep cervical. Go ahead and move to the side for me. Okay, that relieves that a little bit so I can feel better. Same thing on this side. Okay, I need you to hunch your shoulders a little bit forward so I can feel your supraclavicular lymph nodes. Okay, very good. All right, Darian, I'm going to need to listen to your carotid artery to check for any bruise. So I'm going to use my stethoscope. I'm going to have you take a deep breath, let it out, and then hold your breath, because when you're breathing, I can't hear. I hear your breathing, but I don't hear your blood vessel. Okay, and hold it. Okay, take another breath, and I'll check the other side. Carotid arteries are equal bilateral and no bruit heard. All right, Darian, I'm going to check your thyroid and your trachea. So I'll be moving around to the back. Okay, Darian, go ahead and lean your head a little bit, just a little bit, forward, and swallow for me. Good, trachea is in line. Thyroid is non-palpable. Okay, all right, I'm going to check your transverse, posterior, anterior transverse ratio. Okay, that is it is within normal limits. I'm going to check your chest expansion. Hold on a second. Okay, I want you to take a deep breath. Good, chest expansion is normal. and within normal ranges. I'm going to check for any kidney inflammation. I'm going to do a little bit of percussion. Let me know if it's tender. Did that hurt?
No.
How about that?
No.
Okay, Darian. I'm going to listen to your lungs. I'm going to have you take deep breaths every place that I touch. If you start to get a little bit dizzy, let me know and I'll stop or slow down, okay?
Okay.
Take a deep breath. And exhale. Again. Good. Again. 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 You doing okay?
Mm-hmm.
Okay, again. Okay, and laterally. Okay, Darian, I need to move around to the front. Breathe in again. And again. Again. Doing all right?
Mm-hmm.
Two more times. Good. Lung sounds are clear all the way to the bases bilaterally. No advantageous sounds noted. And resonance is clear. Okay, Darian, I'm going to have you go ahead and get under the covers. I'm going to check your heart and your apical pulse. Okay. Apical pulse is at the 5th intercostal space, left mid-clavicular line. And it is S1 and it coincides with the carotid arteries. Which it does. Which it does. I'm going to check your rate. Very good. Rate and rhythm is good within normal limits. It's 65. Look at your chest. No heaves or pulsations noted. Okay, and now I'm going to listen to your valves. Okay, Darian? Make sure they're intact. Okay, the aortic valve is at the second intercostal space and right sternal border. Pulmonic valve is second intercostal space, left sternal border. Erb's point is at the third intercostal space, left sternal border. Tricuspid valve is at the fifth intercostal space, left sternal border. And the mitral valve is at the fifth intercostal space, left mid-clavicular line. Okay, Darian, I don't hear any murmurs. I'm going to take a closer listen using the bell. Aortic valve, second intercostal space. Oops, I turned it wrong. No, that was right. Good. Second intercostal space, right sternal border for the aortic valve. Pulmonic valve, the second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid valve, fifth intercostal space, left sternal border. Mitral valve is at the fifth intercostal space, mid-clavicular line. S1 is louder at the base than S2. Apex. S2 is louder at the base than at the apex. S1 is louder at the apex than S2 was. Okay, still no extra sounds or murmurs. Thank you, Darian. I'm going to check your app and go ahead and pull your arms out. Okay, I'm going to listen to your vowel sounds, and then I'll be doing some light and heavy or deeper palpations. But first I want to look at the contour of your abdomen. Abdomen is flat and symmetrical. No lesions, redness, masses detected just from observation. Okay, let me listen to your vowel sounds, starting with the right lower abdomen. Okay, abdominal sounds are present in all four quadrants and are tympanic. All right, Darian, I'm going to do some light palpation to see if there's any masses. Okay, I also need to percuss too. I'm going to listen to any tympani or resonance that you have. Okay, that sounds good for the resonance. It's all resonant and equal bilaterally. Now I'm going to do some deeper palpation, and to check your organs, I'm going to have you take a deep breath and hold it. Check your liver. Liver is non-palpable. Go ahead and let that out and take another deep breath. This is for your spleen. Spleen is non-palpable. Okay, I'm going to check your left kidney. Go ahead and move to the side a little bit. Kidney is non-palpable. Okay, right kidney. Right kidney is non-palpable. Okay, thank you, Darian. I'm going to check your extremities. Okay. Arms are smooth. Temperature is equal bilaterally and warm. Trigger is good. Fingernails are pink. No clubbing noted. Radial pulses are equal bilaterally, and I would give them a 2+. Okay, Darian, I need to move your legs out. And this one out too. Go ahead and pull down. Okay. Legs are smooth, skin tone is good. Skin is warm and equal bilaterally. No redness, no lesions. Dorsal tibialis pulses are +2 and equal bilateral. Posterior tibialis pulses are present, equal bilaterally, +2. I'm going to check for some edema, see if you have any edema. I'm going to put some pressure on your legs. No edema noted. Okay, Darian, I'm going to do range of motion. Okay. I'm going to have you raise your leg all the way forward, or straight up and down, and then bend at the knee, please. This one. Okay, now bend at the knee. Okay, can you turn your foot in? Turn your foot out. Okay, now move your knee in, and your knee out. Very good, go ahead and lower it. Okay, and same with this one. Straight up, raise your leg straight up, bend at the knee. Okay, turn your ankle in, your ankle out. Okay, turn your whole leg in, your whole leg out. Very good. Range of motion is equal bilaterally, smooth, and within normal limits. All right, Darian, I'm going to have you go ahead and sit up. And check your deep, go ahead and sit up. Check your deep tendon reflexes. I'm going to go ahead and tie that for you. Keep slipping down. All right. Okay, I'm going to have you put your arm right here like this. Up. This is going to test your biceps, deep tendon reflex. Good, very good. This side. Good. Check your triceps. Go ahead and relax your arm. Relax it. Okay, good. This one, relax your arm. Good. +1 on both the biceps and the triceps, a +1 reaction. Okay, patellar deep tendon reflex. I'll give that a +3. And that also a +3. Okay, the Achilles. That's about a +2. And that's about a +2. Very good. Okay, Darian, I'm going to give you my fingers to squeeze. Go ahead and squeeze them. Good. Strength is good and equal bilaterally. Now I'm going to check your arm strength. So I'm going to have you pull towards yourself against my arm. Okay, now push against my hand. Good. And the same here. Pull and push. Good. Strength is very good and equal bilaterally. All right, Darian, I'm going to have you go ahead and stand down. And I'm going to check your spinal mobility, range of motion. Go ahead and lean forward and touch your toes. Good. And lean all the way back as far as you can. Good. And turn towards me. Okay, and lean to the side. And all the way to the side here. Good. Okay, I'm going to test your cerebellar function. Go ahead and put your feet together. Arms down. Close your eyes for about 20 seconds. I'll count to 20 seconds. And stay like that. Okay, you can open your eyes. Very good. No swaying. Lomberg test is negative. Okay, Darian, I also want to check your range of motion in your upper extremities. So I'm going to have you raise your hands up over your head and then bring them down behind you. And let me see, bring them up as high as you can. Very good. Okay, now bring your hands behind your head. Back behind your head. Okay, now put them up over your head with your hands together. Now smoothly bring them down and cross them in front of yourself. Very good. Range of motion is within normal limits. Now I'm going to have you walk towards the dresser and turn and walk back. The gait is smooth, rhythmic, and coordinated. Very good. Okay, thank you, Darian. That's the end of this head-to-toe assessment. Do you have any questions?
No.
Thank you very much.